Yes.
So, yeah, so it's a Halloween edition and it's a Postural Detective office. I'm a corrupt police officer. No, I'm just kidding. Police officer is never corrupt. Same as a doctor. They always tell you the truth. They always tell you the best for your health. Today, we're going to talk about that shoulder impingement. So, shoulder impingement. It's a lot of clients come with this pain, and it's most of the time it's pain right here in the front of this shoulder, right in here. And we ask them to do some tasks, lift the arm up, do some range of motion, and they always fail. They always experience pain. So what's happening here? Most of the time, of course, it's your postural, because your scapula start pronated forward, that's mean it's collapsing this way. I'm not sure if you can see me on this camera. So it's collapsing forward. You can move that. You can complete that action up. So lift this arm up because the scapula is pronated, and its bone, that humeral bone, it's not balanced. So it's not in that socket. So most of the time, one of the muscles get affected. So we got 4 or 5 muscles up here. I would say 5. It's a pectoralis muscle. It's your supraspinatus, infraspinatus, subscapular muscle right under that scapula, right in here, and of course our biceps. Because
teres minor.
Yeah, teres minor. It's just a tiny bit. I would just put this as the same. David says it's a teres. Yeah, it's a part of the pectoralis muscle group of muscle.
So rotator cuff.
Oh yeah, rotator cuff. It doesn't, like I said, it's just. The scapula is start pronated forward. And why? Sometimes it's not just because it's just a scapula. It could be your hips uneven, the uneven hips, and you try to balance it, you try to sit, try to do, like I said, complete that action, lift it up, pick it up, pull towards yourself. And that's what's this muscle is unbalanced, or your postural imbalance, this create that problem, and that starts this pain right here. And all different pain. You try to lift something up, you feel pain. You try to pull something towards yourself, it's a pain. Like I said, it's different group of muscles. Sometimes you feel that biceps is tight, you try to extend its pain. So the thing is, this is the first symptoms right now. Like if you feel that little pain or some like a pulling sensation, burning sensation. Later, it could be create more problem like a frozen shoulder, and this is our Ivan frozen shoulder. This is in the case in our Postural Detective. This is the like a last stage when you completely ignore this pain and you never pay attention to that, or you have pain, but like I said, you ignore it, and that's the shoulder is completely stuck. You can't move, you can't do anything. And I see people walk like this with that shoulder like a robot. Their one arm is like nice and moving. This one is locked. Also, that shoulder is high, and people come in like this. So it's completely start change everything. And they have headaches. They have a bunch of stuff comes in. So don't wait for too late and start doing therapy. Start with a manual therapy. Start with those trigger point therapy. Get that scapula back. Get those talented therapists who can work on that scapula and pull it back. So this is the idea of this shoulder impingement. And like I said, it's no need to push it too far. Wait for too far. Okay, so now we're going to get that our clients. So we're going to do investigation on him. We're going to do some postural assessment. And David will begin this assessment, and we go from there. So what else I want to say here? Yeah, so like I said, muscle effective, we're going to talk about this during our assessment. All right?
Yeah, so
that's going to be good. So David is going to do postural assessment on that shoulder. We have a shoulder pain, and I'm going to help if needed. So I'm going to just hang up here and just enjoy it. It's all yours.
Okay, now, so you have a shoulder problem.
Yes.
Which shoulder is it?
Left.
Okay, your left shoulder. All right, so I'm going to have you stand up, and if you could take off your shoes
Yeah, here we
socks, that would be good.
Always take a shoes because the shoes.
We're going to look at your feet and just do what we're going to do. And you could take your socks off too.
Whoa, socks? Okay. I usually.
No.
It's up to you. You want to take socks? Yeah, why not?
Well, because you could see.
You can see better, yeah. It's true.
Yeah, so we're going to analyze and
Yeah.
figure out about his shoulder. All right, so I'm going to have your feet okay, and I'm going to bring them apart just a little bit here. I want to take a look at your feet here.
So you don't see what he's doing, but the thing
He's
is...
got a
actually you
little
see
bit
on
of
this
an
camera.
arch. He's got a little bit of an arch.
But I'm flat.
Yeah, there's a tiny bit of it. It's not completely flat. And your knees, I think they're a little bit in. They are a little bit inward.
Okay.
Let me see. I'm measuring. This one looks a little bit higher. So these are my thumbs. So this is a little bit higher. Just a tiny
Do you
bit.
want me to stand on the side?
No, like try to more relax, because look at him. He's very like.
No, I'm relaxed.
No, you're not. This is the problem. People think I'm relaxed, but they're not. And when you lay down on the table, you just start work on him, and he's like, he not let it go. He's like, oh my God, I'm not let this life go. I'm not let this guy go. He's all yours, completely. Go ahead. Yes.
Okay. So I'm just taking a look and measuring the feet and seeing if there are big differences. But the feet being a little bit flat and the knees are a little bit in, a little valgus.
Mm-hmm. What
Okay,
about
I'm gonna
hip?
Take a look at his hip here.
So what he's doing right
I'm gonna
now,
have you take off your belt. So
he's
I'm gonna
looking for
measure
that.
your-
He's looking for that anterior sacroiliac bone, and when you find that little groove up here, you just start get that 2 fingers under, and you see the level. If this is higher or yeah.
Well, this one is a little bit high, just a tiny bit.
I'm already saying he's gonna get problems because look at this. He's always wearing that wallet in the back of pocket. So now think about it when he sit. If this wallet, and it's not that small wallet, it's like that thing. It's like like an inch and a half. Now think about it. If you sit down on that right side, that inch and a half is gonna push on that ilium and pull the whole spine up. Even this can be caused the pain problem in the shoulder. Might be. That's why we investigate it and try to find this out. But it's good the person come in with this wallet inside. Go ahead. So what do you think?
The left hip is a little bit high.
Left hip?
Left hip is high,
Okay.
just a tiny bit.
Let me check too. So
Yes,
come
I'll have
over
you check.
here. Yeah, I would say yeah.
that's what I see.
It's obvious. It's obvious.
Yeah.
It's good.
It's just a little bit higher than the other.
Yeah.
Okay, so I'm going to have you this way here. Now I'm going to take a look at your shoulders here.
Mm-hmm.
And they look pretty good. It doesn't look too bad. He's not too...
It's not too bad.
not
Okay.
No, his shoulders are more even. And his eyes, the head is a tiny bit tilted to the left. Just a tiny
Okay.
bit.
Okay.
And
I
his,
have a little bit of scoliosis on my neck.
So you see, the clients already know something. That's why with the postural detective, we ask those questions. We want to identify where is the problem is. What else? I can add something after
but his
David is
neck
going to
is
be
a
done.
little straight. He doesn't have as much cervical curve.
So yeah,
The
it's
cervical curve is much straight. Look at this, Yuri.
yeah, it's called military neck, and it can be cause the problem in the future.
So it's a little forward. Because of that, his head is a little bit forward. It's just a little bit.
I would say he tilt a lot in his lower back. He's got this lower cross syndrome. When this anterior tilt, it's always problem with this camera. Let me find the David.
Okay.
There we go. So you can continue.
Okay.
Sorry.
So you're seeing his hip flexors are probably a little tight because you feel like
Yeah.
they're rotated.
So that anterior tilt, which means it's that hip is tilted forward, and it's too much pressure on that lumbar area. Hamstring is constantly pulled. That what else can be? Your glutes is weak. So if you put this two cross line through those hips, one is coming that way and one is like an X. So it's going to tell you which muscle is weaker. But usually lower cross syndrome, it's a tight quadriceps, overstretched hamstring, weak glutes. What else? The hip flexors could be overstretched too. Yeah, chorus problem, and what else? What David already done? Let me recheck here too.
Performance too can be issue.
Yeah, so you see the pec muscle it's very tight. So he's right in here in this pec muscle.
Yeah, it's forward. They're even
Yeah.
this way, but I mean, yeah, it is a tiny bit forward.
So
The pecs are tight. The shoulders roll just a
Right.
little forward.
and remember in the beginning of the class I said that pecs is dominate. So the pecs is pulling him forward, and that scapula is pronated forward. So our first mission is going to be release that pecs muscle. This is what we're going to do. So David, you go ahead, do some shoulder test and neck test. Let's see if it's in the
I'm going
neck.
to see your neck. Yeah, so I'm going to have you turn your head to the right. That's it. And we got 80 degrees. That's not bad. Do you feel any pain or pulling or anything? Okay, now turn to the left.
There we go.
That's good.
It's good. You think it's good?
Oh, it's not.
I mean, it's
Is
up
it
to
80?
you.
Is it 80?
Yeah, it's pretty good
He's
actually.
compensating a little bit. So
But it's
here.
not bad. You're right. You're right. It just
not bad.
for me from this side because the
Oh.
shoulder it's a little bit different.
Okay,
But here is more easy, but this way
Yeah.
is more little bit
compensate.
tighter.
Yeah, compensate a little bit. It compensates as you turn, like you're
Yeah.
angling.
Exactly.
Yeah,
we always
yeah.
we
It's
always
seen.
we
Right.
always ask the clients and just describe your movements. Just describe what you feel. You're doing really good. I love it. I love it.
Now
He's-
I'm gonna have you.
David
look,
is a
I'm gonna have you look down, so your chin should be able to hit your sternum.
It doesn't.
It
Exactly,
doesn't. So, there's a
so-
little gap here. So that just means his neck flexion isn't as good.
When I pull it,
Just
more
a-
force it,
you
I
feel
feel my levator scapulas and my trapezius are starting pulling
pulling.
right. Okay, so you feel it. You feel
Yeah.
it on both sides.
on both sides.
Okay.
But on this side, a little bit slightly more.
Mm-hmm. Okay, I'm going to have you look up and see. Now, that's not quite, it should be more. You're more,
A little bit,
No.
but yeah.
it's
So it
not,
have to be 80 degrees.
it's not 80, but it's
Yeah.
maybe, I would say it's like 45, 50?
50s, 55, yeah, it's more
55?
than that. It's not bad.
But it's not 80. It's not bad, but there's room for improvement.
Yeah, exactly. Always. And now our major suspect, it's a shoulder, right? So we're going to test all those muscles.
Now I'm going to cross you here.
That's pain.
Oh, wow. Already. You
Already it's pain.
See? And that's,
Feel it
this
on
is,
my rotator cuff here.
exactly. So
Mhm.
this
You
is could
see
be
it,
that
feel it in
supraspinatus
here.
muscle. Remember,
And
it's
so-
coming
so
under
going
your
up,
scapula, on the top of
that-
your scapula,
I don't
under
have
your
pain,
acromial
but
process,
kind of
and around
feeling
that bone.
discomfort.
Yeah, what
So it
he's
goes
saying
about
now.
to here. Is that it? Right to there?
Now I'm good. But when
Wow,
I start
so it goes-
down, up.
So
okay.
it goes right up
Yeah.
to here.
Yeah,
you
now I
can
feel
you can do it's called
Right.
near test. You can do this. Watch. So you step up here. You flip that arm and you just raise it up and see if any pain present on this between this 60 and 120. Like this. So the bit the
turn
pinky pinky up. Yeah, you turn out and you just raise it up.
Okay, so
Start raise up slowly.
Yeah.
Pain. That's it.
Is that
So
pain?
yeah. See you see.
not too pain, but it's like feeling pulling.
Okay.
But
But if,
now, okay.
you see
Here,
yes.
yeah.
But if you go apply a little bit pressure, come up. Is that more pain?
No.
It's released.
It's released. Yeah, kind of.
Okay. So yeah. Next one is you flip this way, thumbs up. This could be 45, and you push and resist it. So you push, pain,
Now pain.
pain. Here we
More
go.
than like 5 pounds is pain.
Now
There we
I'm
go.
gonna push down and I'm going to push up. Does that cause any pain?
No.
Okay. Check that subscapular muscle. Remember the subscapular
Yeah,
test.
Now I do it different ways, but okay. So you're
Show,
going to
show,
bring
show, show to the camera.
So-
show to the
So you're
camera.
bringing it back
Oh,
here.
you want to? Let's.
No. Side is perfect. Yeah, you can
yeah,
see. Yeah,
sideways.
excellent.
This is good.
So
So now you're gonna push. You're gonna push in this way. Yeah, that's right. Does that bother you?
So he's pushing out, and
No.
he's trying to get through the body.
I just feel tightness
just feel tightness.
so
okay.
it could be not
on
such.
my upper chest and little bit my.
So we got suspects: pecs muscle, infraspinatus, supraspinatus, and what else we can test?
Well, I'm gonna have you turn this
Biceps,
way. I'm gonna
yeah.
check your external rotation. So, what's your range going here? Does that bother you?
No.
This is
But
okay.
this one I'm fine. But if I bring it up,
No,
now
yeah,
it's
you don't
good.
need to. Yeah, this one, another one. You keep it up here, and what you're doing, you push inside. So push, is that pain?
No.
Push outside. Okay. Now push inside. Is any pain?
No.
You do all that kind of
Only when he
tests.
gets to these extreme
Yeah,
ranges.
and when he's get to the 120 degrees. I mean, between 60 and 120. So this range is painful, and it's called near test. Yeah. So shoulder impingement. Here we go. We got
Straight up.
one.
How high can you go when you bring it straight up?
I can go
Very good. So it's not. He doesn't have frozen shoulder.
Yeah.
gladly.
That's good. And then I'm going to have you do now extension. So turn this way. Have your elbows straight. I'm going to bring this back. How does that? That's not bad. Does that bother you?
No. But I go a little bit further. I feel
feel it.
full
Yeah. So we don't
Up
need to
to my-
test more.
triceps.
Yeah.
All the way. Okay, so you'll
Yeah.
feel it into here.
Yeah.
Do you ever have any symptoms down in your
No.
to your arms? And you can straighten out. Oh, so when did this first happen?
I can say maybe a couple of weeks.
A couple of weeks ago.
Yeah.
Did you do anything? Do you know how it happened?
Yeah, exercise,
Weights.
weights, exactly.
What did you do over your head or external
What
or
I cannot-
deltoids?
Deltoid maybe, and deadlift probably,
Mm-hmm.
pushing like shrugs,
Uh-huh.
and yeah, technically maybe that was it.
Mm-hmm. And so it doesn't radiate anywhere. Okay.
It's
And
more here, this area.
Yeah.
it
Am I-
doesn't. It doesn't
It's a
go
good
into your
question,
neck?
guys.
No.
If client feel radiation down the fingers, it could be not the shoulder impingement. It could be a cervical problem because this shoulder, tingling, numbness in your hands, it's come from your cervical area, and it's a lot of issue up there. So don't miss that up. Pain up here, or it's go all the way down, and it's like could be. What I'm usually do to not guessing, I send client to do MRI or X-ray to make sure it's nothing
Actually, I'm
up
gonna
there.
have MRI too. So
Here we go.
You
You,
are.
see?
yeah,
Okay.
because if I
what-
don't see it, I'm not gonna go for it until I have MRI and result to see what exactly it is.
Look, if even MRI shows you something up there, what you first do, you do physical therapy
Therapy.
first. You not go to the doctor right away and do some surgery. People say, okay, surgery, it's a solution. Give yourself time to self-heal, because think about it, if you're going to do surgery, that scar tissue is going to be there more and it can create more problems. And don't do those steroid shots, please. Just like I said, give yourself time. If you can't handle this anymore, if you feel so much pain, yes, of course, go to the doctor, do your shots, do your surgery, but give yourself time to try to rehab this in a natural way, in a motion way. And like I said, sometimes the problem could be not in the neck or in the shoulders, could be more deeper. You see that wallet up there on that right hands when he sit down is probably this is what's happening. Look, if I push this wallet down here, what's gonna happen with me? I'm gonna start doing that.
Shoulder raise.
Yes,
Or
exactly.
the way that they're driving,
Yes.
sitting, tilting
Yes.
body, and also sleeping.
Yeah.
If I can add something, try to not to sleep on the side that you have pain, unless keep it comfortable.
Everyone
With
sleep on the
zero,
side.
yeah.
Everyone sleep on the side.
Especially the one that has a pain, they sleep more to comfort the pain. But no, just let it go. Use the cushion and
I
keep
know,
it
but
soft.
trust me, people ask me how the
Yeah.
best time to sleep. If you record yourself how you sleep, you're moving like this. You're gonna go there, this, that way,
Yeah.
flipping on your belly, on your stomach, because you don't control that. It's very hard to control when you sleep and be all the time in that one position. Okay, so David, it's great. I loved what you did. We
One
find
last
out.
thing.
Yeah,
I just
go
want to
ahead.
find out what level of pain on a scale of 1 to 10. How much pain do you
Well,
feel
if
like?
I go
when it's-
on this
yes.
level,
Yes.
it's like 4, but generally is 1.
And if it goes back like that, is that
Not much, maybe 1.
1? Okay, so it's not bad.
No.
Okay.
Okay, very good.
Because what I did, I tried to prevent not to get worse. So I did PT, physical therapy.
You have.
Yeah, resistant bands. So I tried to minimize the pressure on the muscles and ligament and joint.
And that helped you, right?
Yeah, otherwise it would get worse.
So we do manual therapy right now, and after we do couple exercise with resistant bands already. What Elbron says, we're gonna do those bands after our manual therapy and see how he's feeling. We want to see the effect of our therapy. We want to be honesty and see if we change everything. Okay, let's do that. David, tell us what you're doing here.
Okay, so first of all, you can see the shoulders are both high. This is coming off the table here. And so is this one. But this is his problem side, so he does need to have, that worked out. So I'm just warming it up right here, just taking a look. I usually start, I want people to trust my hands, so I start up here and I feel if there's any pain or anything. But you don't have any problems with your neck or anything, so.
Yeah, and if you guys...
But it's funny, when you go by my traps and my thoracic, when you're coming up, I feel slightly like energy, like kind of nerve system is moving.
David, you're going to block the camera then.
No, I'm going to sit here.
Okay.
Isn't that good?
I mean, kind of, yeah. I don't know why you changed the position, but...
Well, I've got to work on this shoulder.
Okay. So, we're going to keep moving those cameras.
Well, you're
because David always jump around.
Because he's your cinematographer.
Yeah, I'm a cinematographer. I really love to do that. All this change the cameras and you can see it.
You need to get drone too.
Yeah, you definitely can see
drone.
on this one.
Yeah.
So we're gonna switch to the small cameras. You guys not gonna see on the big camera.
Oh. No, we can't see on the big camera.
That's fine. We're already doing it. So tell us what you're doing.
All right, so now I'm going to do some work on his pectoralis major. So it's very tight, and so I'm just warming it up. So I'm feeling, where is it going to be tight? Where are the tightest spots? Of course, I know his deltoids are going to be tight right here.
Actually, you're touching it right.
Yeah.
And if you go a little bit slightly down, there you go.
So his tendon attachments to his deltoids are very, very tight. Very tight. It's the belly of the muscle down, but it's not on the top part, although I'm going to work the top part also. So you can figure out by warming it up and pulling your fingers into it where the problems are. So I'm just going to warm it up here and seeing. I'm going to loosen up his pecs, and I'm going to do it so here. So these are going to be a little bit tight. Is that pressure okay?
Yeah.
All right. Now, I'm getting a lot of warming up in here, so I'm going to take it. Now, you can go to about there. Is that okay there?
Yeah.
Okay, so now I'm going to work on his pecs. And I got to find out where his pecs are. But you can feel when his arm goes back, these are overly shortened. This whole unit is overly contracting, much more than it should for that position. So you can tell right away that that's where his pain is. He didn't even have to tell me because it's very obvious. So,
And one thing that I noticed before this happened,
yeah.
my shoulder was clicking too much.
Oh.
And when I was doing exercises, like when I was doing press chest or shoulder press, I could feel that my rotator cuff was tuck was clicking.
So that's already give the sign something is not working properly, and you keep working. You keep
Actually, I stopped.
Yeah, it's good, but people keep loading that shoulder. It doesn't like shoulder, knee, hips. and that's create trauma and injury in the future. So you feel something is not there, you always have to correct it. Find a specialist and work on it. And if you guys in Los Angeles, we can help you. David, LeBron, me, Yana, we have a Sarah, we have a Clarissa, people who can truly help you and work on you. So, okay. And of course, David put too much oil. You see, the David is the person who worked with a lot of oil.
Yes.
And me probably not going to be oil at all. But that's fine.
Well, the reason,
we're all
yes.
different.
The thing is that this is, I want it to feel good. And I don't need, I could find all his problems.
I want my client feel pain.
Me too.
I'm just kidding. No
You
pain,
too?
no pain. Some clients love pain. You see, he said, I want to be pain. But it's no pain.
Well, I'm warming it up, but I can find everything. And
It was funny when you were doing on my petrol. I could feel it in my back shoulder.
oh, you could.
Yeah.
So one of those trigger points can radiate back to that shoulder. And I always work on the pecs first. And trust me, pecs, you release the pecs, it's going to be like halfway done, the job. Because pecs is, most of the times, pecs is very effective, this problem.
So pecs are good. So I'm going to go back. So I warm up I do the pecs and I'm jumping around. And I'm soothing it out. So I work on it and then I'm going to go back again. Because when his arm crosses, this over contracts. So I know that he injured it probably when he was crossing. You were probably crossing it and it over shortened for that position. So I'm going to fix it in that position in a minute. But I'm going to first warm it up a little bit more this way and look at his pec minor here and see if it's tight in here. Let's make a little bit of extra room in here. And I can feel where it's tight there. Does this feel painful?
No, but feel good.
It feels good?
Yeah.
Okay, so now I'm moving it. I'm getting it to open up more. And then I'm going to go to your... Now, he has trouble with external rotation. So when his arm goes out, he has trouble. So his biceps are external rotators. So I have to make sure that his biceps are good. So should I sit? So here I'm going to be like this. And I'm going to warm up his biceps. So his biceps are going to have some trouble. So I can tell they're very hard here.
Yeah, I can feel tightness.
Yeah, so, but the biceps, so external rotation or internal rotation, you have to look at biceps because biceps are external rotators, and if they get stuck or jammed, then you're going to have restrictions on internal and external rotation. He doesn't have trouble bending his elbow, flexing his elbow, but he does have trouble bringing his arm back. So I'm going to find where those troubles are. Now, in here is the attachments to his biceps. There's the long head and the short head. So I'm going to go in here, and I'm sliding around, but I'm sliding around, and it feels okay because for him, I'm warming it up, and the pain is going to be much easier. If I didn't use as much oil, then this would hurt more. It would just hurt more, and I don't need to make it hurt that much. I want it to feel kind of like a massage. It's more soothing than Yuri's.
No soothing.
Mine is soothing.
Okay. If you want a soothing, it's a David. If you don't want a soothing, yeah, you want me, goddamn it. Or Il Braun, that's for sure. So we get you there. But yeah, maybe it depends
we can get you in the middle too.
Yeah, maybe, yeah.
Right.
So yeah, this is what the David doing now, and it's
now I can
great.
feel his I could feel where it's stuck. So all he has is some stuck deltoids, and his pecs were very tight. But now let me take a look at the biceps again. So I'm just going to finish this part, and then I'm going to be turning him on his side. So here.
Before you turn him on the side, I'll show you what I'm doing.
Okay,
and
sure.
we just don't want him to go back and forth.
Yes, no, that's a good idea.
Yeah.
Here. It's a little bit tight in there. Do you feel a little bit tight?
Yeah, not little, but a lot tight. Honestly.
But you can handle it. It's
Yes.
not too much pressure.
So you see,
No.
as-
For me, it's good.
as we've been saying, the pecs is effective, the biceps is effective, and this is could be already solved the problem. And like some people wait for so long, they think it's gonna go away, and that's a big problem because it's never gonna go away. It's always gonna stay there.
And even because we do daily activities, it's causing more pressure, and life can give you more stress, and the stress is causing another issue on it.
Yeah.
Now I'm gonna do one more thing on his rear delt, and then I'm gonna do his pec again, and then I'll let you do some work on him.
All right.
I'm gonna
He's
first.
He's gonna be like hours and hours of
No.
massage here.
No, I'm just doing a little bit, just a little bit, just.
We don't want him. To
I'm just
work on
doing.
him. He was late, so we're not gonna do that much on him.
I'm gonna do just a little bit this way.
Actually, even if you feel it went more. My range of motion, it got a little bit more.
It's gonna be good, but the problem is your deltoids got jammed, so they don't. They're over contracting, so they're over shortened. For this position, your lateral delt and your rear delt are over contracted. So I have to put it here and put them back to the way it belongs. So you can relax. I'm just going to do it a little bit more here, because you just got to be
He's worked so hard, man.
Yeah. I am working a little bit hard.
Yeah, he's old school.
I'm old school.
Old school, god damn it. Old school.
Well, old school is good.
I don't know.
I'm gonna cross you here.
I'm
gonna
gonna
do
doubt
some-
that.
And I'm gonna take a look at his pec here. When it's here. So you see how hard it gets here.
So you contracted pack and you work on that. Okay.
Yes, because it's over shortened. I think he injured it when it was crossed. I think it was contracted, over shortened. What does it feel like? Does that feel tight?
I feel tightness, but no pain.
Good.
Like
That's
the
good.
first time that you started, compared to now, there is maybe 3% less pain
Here we go.
and tightness also.
10 minutes work and it's 5% less, 10% less pain already. How
It'll be
beneficial
good.
is that? Why are you people
So
still
here-
waiting with his shoulder
Oh,
pain?
actually, that is so good.
Oh, wow.
I
you
can
see?
feel relief, honestly, in entire my body.
Yeah.
Yeah, here we go.
Well, I wanted to warm it up first in those other ways before I did this, so I could have more.
Well, I can say exactly your thumb is where I feel like radiating the pain.
Uh-huh.
Oh, that's so. Feel good. No feel pain. Feel relief.
Yes, because that's what we're about here at Life RX Wellness.
Exactly. It's
want-
all about David work, pain relief.
Pain relief.
He's a painkiller, postural detective. He identified the issue. He started working on the issue. Just think about it. This is the amazing work, and he's in Los Angeles. His hand is waiting for you, guys. Book him.
My nickname is Advil.
Advil. My name is Heroin. Because I am cutting off everything.
Heroin.
Heroin, yeah, no, I'm just kidding. Bullet. You see how work is hard? I mean, I can't believe I can't do this because it's too much on my fingers.
I know.
It feel probably good for the client.
Does this feel good on client?
Yeah, it just. Honestly, really, it is Advil.
Oh,
Because
wow.
I'm falling asleep.
Okay, good.
Are you?
Oh, yeah.
So book David, and we're not supposed to forget to work on the neck. Remember that neck don't have a curve, and we have some issue with this neck.
Yes, he does. And you can also do the front delt. So the front delt also got tight in this whole thing. So this is where you got tight in your front delt. So I need to put it in a shortened position so that to fix this part This is actually, it looks like I'm working very hard, but this is every day.
Yes, you are.
Every day for
No,
me.
you are. You are working hard.
I'm
trust me.
definitely, but
All right, let's
Okay,
let
all
me
right, so
jump in.
I'm
Let
all
me
done,
jump in
I'm
on
all
him.
done.
Let me finish
yes,
this
so
guy.
I did, so
We're
I
gonna
did,
finish
that's
this
all
guy.
I was going to do anyway.
That's
Actually,
good.
See, even
Good. All right. So my next one.
oh my God, help me!
Yes. So
Let me move. Yeah, you can.
Herring, the
Look at the muscles.
the real deal is here. You're gonna be
Look at
arrested
the
right now.
muscles,
Okay.
look at the
No,
body.
no.
God.
Look at this. Look at this arm in the air. So what I'm doing here, yes, it's a little bit oil up here. So what I'm doing, I use my full arm.
Do you want to wipe off the oil?
No. I'm good.
Okay.
So we still have a little bit of oil. So what I'm doing here, I'm getting that packs. And you can see, this is why I catch that fascia. You probably see on this camera. So I catch it. When I move it, I catch him. And what I'm doing, I move that medial to lateral. So I move that and gliding. And what I ask him to do is start rotate this in and out. So he's rotated in and out very slowly. And look at my elbow. The forearm is moving. I'm not use my bone. I use my fascia, and I work very slowly. He's breathing. I want to feel that breath. Yeah, that rips. Here we go. I teach him to relax now. You work on this nerve system, parasympathetic nerve system. Yeah, you want that relax, and you start. Always ask, is that okay?
Perfect.
Perfect. So always communicate about pressure. And if you don't like the client, you can push harder. If you don't tip you a lot. If people
Or they are late.
or people ask you, is that tip included? That's it. That's a bad sign. It's a sign to push it stronger. No, I'm just kidding. You see, and this is what I do here. This is the packs muscle. Next one, it's my favorite. I want to work on the whole that humeral bone. I want to mobilize that inside that socket. You can use, if this is the bigger person, you can use your between the legs, or you can just grab that humeral bone, lock that scapula, shoulder, so it's not coming. You see, and you start stick that bone in very lightly. So you see, I move with my body.
I can feel it.
You can feel it?
Yeah.
Here we go. You feel it. So you can pull it in, hold it. You can see on this camera. Hold it for, I don't know, 1 minute you hold it. He's relaxed, he's breathing. And next one, I can start do small rotation.
Yeah. And
You
this
see,
is,
I'm pulling in and rotate.
and this is especially good for frozen shoulder.
Yes. I show you if this is a big person. If you're the big person, don't pull all the way to your crotch. The arms have to be between your knee, because so you're doing this. You're coming up here. You see, you jam that arm, and all you start doing this. Try to relax. This thing is on my way. I have to remove my badge. And you start doing this.
Oh, I can feel it in here.
You see what I'm doing? I can move my arms. You probably don't see because you see my butt on this camera, but this camera shows everything. So you see what I'm doing?
I can feel it on my scapula and
Yeah.
also on my neck.
Yeah, there we go. And you can
On my
pull.
shoulders.
You can pull a
Yeah,
little
that
bit.
pulls the humerus away from the.
Yeah. And you can stick, rotate. You can pull, rotate. And this is kind of thing. Next one, what I love to do, I like open that packs. I rotate this arm without any pain. So you see my hand, it's kind of grab that shoulder and I pull it. You can ask him to resist, so he can resist 2-3 pounds. Don't resist too high, too strong, and relax to let it go. And you just rotate it. You create more. Pull. There we go. And let it go. Next one, I love to go under the scapula. I grab right here. It's not my favorite position because the camera, I usually stay on the opposite side, but I'm start doing this. You see, I'm start moving. Open this up. Look at that. You can hold that arm. So you see the arm is kind of up here. I'm supported, and I'm start doing this.
Wow.
There we go. And it's just been big pop. You see,
Yeah.
I'm doing this motion. I push, and I push it down. And
I can feel a boom.
that's
boom.
it. Yeah, it's boom.
There we
Open
go.
more.
Yeah. There we go.
You can just do distraction, grab that. Don't grab wrists. I like see people like and try to, I don't know, moving around, jostling. Just grab it, right here, forearm, and just do pull. A little bit shakiness, step a little bit more, different degrees. Shake up here. Don't go higher. Some people go higher more than 120. With that shoulder, no. But with a healthy shoulder, you can do it. So come back here, biceps. Biceps, I love to work this way. Sit down, don't work hard. So the arm, he's just asking to pump. And what you're doing, you can use the forearm like this if the person is big. You just pump very slowly. You can try to extend, or you can come up here, get that knuckles, and ask him to do that. Pump and relax. And you're just gliding down.
Don't forget breathing.
Distal, yes, of course. Don't forget to breathe. You can do stuff like that. You see the biceps? Here we go. Just pop. And you're just moving around.
Even my wrist is popping.
Yeah. Because we got action. This is my favorite. I grabbed the ulnar. And I'm doing this. I'm just moving. Open this up. This is for the wrist, but we're not working on the wrist right now. And guess what? If you have that shoulder problem, you start getting the elbow problem because the scapula is rotated forward and it can be locked in. Okay, so this is, probably, I can work on the subscapular muscle. If let's get the camera up here. Is that still working, this one?
Yeah.
So, I always put that sheet. You see, I put the sheet, and some people say, oh, it's a lot of like artery, nerves up there. Yeah, I understand. So I got that subscapular muscle. I just opened this up, found it, and guess what? It's a lot of adhesions there. And I start asking people, just moving around. You feel that?
Yeah.
People always going to be sensitive in this area. So be careful, be very gently, and
I feel good. Feel relief.
Feel relief, exactly, because adhesion, that non-movement. So it's right in there. I hold in that subscapula. I'm not going up towards that nerve area, that danger zone. I just push it down. I feel that scapula, and guess what? I found that subscapula is, it's really tight. You can move. I ask him, exactly, what I ask him to do, like do his regular routine. Drive the car. Reach up. Do some here. I don't know. Try something. Grab. Exactly. Exactly. You see what he's doing? He's do his stuff. Whatever he do. And he's
Yep.
And this you can book online, and we can come to your house and do the treatment for you. So many specialists here who can do the same thing what I'm doing here. Okay. It's right there. So to work maybe like another 4 or 5 minutes is definitely going to help him out. We don't want we want to see the big difference, but maybe bring this to 4 or 5 sessions and it's going to definitely beneficial. We just, like I said, try to help everything in 1 hour. Pulling, remember he said I push some pull and I feel it. So we did subscap, we did pecs, we do David did deltoids, pecs muscles, I believe, and David gonna be switch me, and you do side position now? Okay, go ahead. So put him on the side. Go ahead, lay down on your side.
Do you want him, is it okay if he faces this way? Or?
Yeah.
I would have done it from underneath too, working underneath in here. So I'm going to get it nice and good so I can warm it up. So now I can also get more of his pec too. So whatever I didn't get, I can find.
Yes. So we always change the positioning.
I'm now working on his pec this way. So now I can find the problems that I couldn't get when he was lying face up because gravity is now falling differently.
Oh yeah. That's hurt.
Yes, we want to cause discomfort.
David try to be the tough guy too. No, he always do nice gentle massage. Trust me.
So this is not painful like the person can't handle it.
Exactly.
You can handle it, okay?
Yeah.
If you experience painful massage, and trust me, no need to. Just tell your therapist, hey, I feel pain, because if pain, they did something not doing right. He do too much pressure, and that's not good because you can relax. You can relax your muscle. You guarding everything. So that's the important to not make it happen.
So I can find what fibers of this pectoralis major is too tight, and I can work on that. I'm warming it up more, and then I'm going in and loosening it up here.
Actually, David, he doesn't give any pressure, but I feel pressure.
Right.
Yeah.
Right.
Yeah,
That's
I can
right.
feel that
Because-
tendons
because
that
it's
has
a
been
special
very
technique.
fascia is very tight.
It's special
Right.
technique. Trust
It's a
me.
very-
Not a lot of people can do this technique.
It's a special technique that you learn.
Tell David what you can teach. And
So
how
all
it's-
the soft tissue therapy. This is soft tissue mobilization or soft tissue therapy, and so there are a lot of techniques that you can use with your hands. You have to know how to use your hands correctly so you don't get injured, and then you can do a lot of things. But this work is an offshoot of Joe Horrigan's work. So actually, it's a combination of his work too. So I combine everybody.
That's good. That's why I'm saying learn technique and do some hybrid, some symbiose, like mutate your technique with somebody else's technique. If you find I love this treatment, like I did release the packs. I like what's David doing with this delts right now, and then a little bit triceps. Sometimes I use this too. I use a little bit different.
Mm-hmm.
Like I said, I'm really picky with my thumbs because it's in pain, and I really use my forearm, my knuckles, my this side of my the fist.
Mm-hmm. So
You
I
see,
use a little fist, but I can find.
You're a little bit blocking the camera.
Oh.
So yeah, we need to learn how to work with the
So-
cameras now. We're learning,
I know.
guys, and thanks for your comments.
So this is where you're getting in trouble.
So this is like I said, Ivan frozen shoulder. It's the last stage you want to do. This is all this thoracic outlet syndrome, the shoulder rotator cuff, shoulder impingement. This is the first signals. And if you keep ignoring this is going to be Ivan frozen shoulder, which is really postural detective enemy number one for the shoulder. And if he's come in, trust me, it's going to be for us longer to fight this guy. It's taking a longer time, and even sometimes we give up on cases because it's too much. You need to go do surgery. So don't give up.
So you could find where it is in
And
the
don't wait.
rhomboid. Yeah, absolutely. Don't wait. These techniques aren't even. They're only known to people who study and learn manual therapy. But so now I'm finding out where all this levator scapula contribution.
Yeah, and like I said, its class can be continue. Work on the neck, the sternocleidomastoid, those scallions muscles, posterior neck muscle need to be work on too. You can work on that supraspinatus, infraspinatus. Remember, but this is
Yes, you can find it more this way. You can find more things. I'm looking for trouble, so I'm going to do just a few more things, and I'll let you try
yeah.
some stuff here.
Absolutely.
So I know that he has a lot of trouble. So I'm going to have you make a light fist. You can't see it here. I'm going to bring it right over here like that, so I can.
So he pushed the fist down.
Yeah. So now I can find problems with his tricep, if there are any. If people have nerve problems, they're going to come through here because this is where the nerves get trapped. But he has trouble with his deltoids. So I can find trouble right here. This is where he's going to have his problems.
Oh, yes.
So I need to make some room in his rear delt and in his lateral delt, and I did some front delt. But because he did the subscapularis, it's making it much easier. So that added in a lot of things. So here I can find what's stuck. So he's just stuck on the attachments here. So all I have to do is a little bit more. It's doing good. And then I can go into here, and then I can find it here. So now I can find some of his lat, some of his, I'm doing his rotator cuff and finding out if there's any trouble. But I could feel it in there.
Oh.
Yeah, that's he's got that subscapular muscle right now. I mean, so I'm sorry, in infraspinatus.
Infraspinatus teres minor.
And teres minor,
so
yeah.
you could see where, but look, this is a
Remember
different
that
angle. And his
scapula is
lats,
pronated.
now these triceps and lats in here. So I'm going to take his arm up, and I'm going to be able to loosen it this way.
I want to say always check that thoracic mobility, because sometimes thoracic mobility, because he limited in this thoracic mobility, it start affect your scapula very quick. So always check on thoracic mobility. And give him the homework to do thoracic mobility. Give him the wall angel exercise. It's the best exercise for the shoulder. It's going to be hard in the beginning, but after like 10, 15 days, the client's able to do that. It's going to correct everything. And that's the key, because if he's come back to you and just you're going to work on him, it's going to help in 3-4 days, but after it's coming, everything coming back. So homework is important. And if you're not certified and give some stretches or exercise, you can always point it people out in a YouTube channel, person you can trust, people you can like you see he's doing what you can be approached to. So that's as important.
This is where you're having trouble.
Yeah,
So it's warmed up. So now I can find where are exactly his problems on his lateral delt. So
Yeah.
I'm going to pin it down on him and then move it for him. So now I'm loosening up that fiber that he was pointing to. Is that right?
okay.
I'm just trying to breathe.
Now I want you to breathe,
Yeah.
because we're not torturing you, are we?
No. Actually, feel is good. It is pain, but I feel relief with that pain.
Mhm.
It's not just like
It's one of the type of
Yes. Okay, so go ahead. I'm going to let you go. And
All right. So what I'm doing here, this position, I usually do work on that traps. This is traps, scallions. I get that spot right in here, the traps. I always ask the client to breathe and shrug against me. So you see, I'm using my body weight. Someone forgot the oil up here, so I don't need the oil.
You can
So-
wipe off the oil.
One arm, I grab that, whatever I can grab, and pull that shoulder down. Remember, the shoulder is a little bit high, and I use my knuckles. It's my knuckle. And I start dragging this tissue down and ask him to push against me very gently. And inhale, he's pushing. And when he's relaxed, let it go. I drag more, and I come right behind that occipital area. I'm not going in the front of the neck, okay? I'm going in the back. So I'm again, push it very gently and let it go. So this is my traps work. You see, I'm leaning with my weights. I'm leaning with my knuckle, and I just work on that. Here we go. You can also, don't forget to work on that serratus muscles. I'll show you. If the person can lift the arm behind his head, and relax, let it go. So this is one of them. You see, I'm trying to get that head more straighter. Let's see if he can do it. So can you put it right in here? Just like that? You feel comfortable?
yeah.
Wow, okay, so it's great. I usually, like I said, I have to stay on that side. Maybe I can try to do this so you can see on the camera. Yeah, so you see, I'm right in here. This is called eagle or tuning fork. It looks just like that, like two wings. I'm apply these 2 wings, and I ask him to breathe, and I start gliding down. Grab that serratus posterior, anterior, and do couple times without any action. Here we go. And this is the fascia. I pull that fascia. Sometimes people feel very sensitive in this area. You okay with that one?
Perfect.
Perfect. So it's great. Now he's going to start breathing and get this elbow towards me. Like this, like he tried to reach. Even a little bit more. Go ahead, go ahead. There we go. Feel that big pop. And release it. It begins to try to reach his big pop. Again. If the person is big, huge, you use your forearm. One side at a time. So this is the area I use in it. So I grab that fascia and I gliding down this way. See, I can feel that scapula. And down. Perfect.
We open more.
Yeah, it went more, of course. You open more and more and more and more and more. Just always communicate with the clients. And this is another one. You can grab that elbow just like that with one arm. You can come up here. You see, this arm is under my armpit. So I'm control it. I can grab up here and I can use one arm right here, gliding this way. And I tuck this down and up. Just like that. See, I'm gliding. This arm could be straight. So I just working this way. Also, this table is a little bit high. I want to work on this rotation.
You want to lower it?
Oh yeah, I can lower, but that's fine. So I just can come in up here. Look, I can grab and put this right behind your head. I want to keep him a little bit more straight. Here, I'm open that pecs, so it's kind of stretch. I place that hand on that scapula, so I can feel it. This 2 fingers come on that elbow, and I'm attached this to my ribs. I need to put this camera right in here. That's fine, no worries. And that's how it looked like. So I'm doing this. Go ahead, push on this elbow. You feel pain?
No.
Good, no pain. Relax, let it go. And this is, you see, this is what I'm doing. I'm moving this arm is come close, and I open this up. Yeah.
Even I feel it on my
Rib.
my chest.
Chest,
too.
yeah, because it's the chest, yeah.
Yeah.
So you see, I pull that chest, open this up.
Stretching.
Get that scapula. Next one, yeah, I can grab this arm again, grab that scapula, and work this way. Yeah, you see, I grab, I pull. This is like hard work. I like to do this way. Look, the person come in, you're always going to I'm going to lean on you, okay? So I always let the customer know, because if you don't, if I'm coming in and lay down on him, he's going to be think like, what the hell he's doing? I mean.
Oh, right.
So yes, I'm coming up here, I lay down on that shoulder, I get that scapula, and I start moving.
That's so good.
That's so good, he said. You see, I'm not working hard. I just use my body. If you're a woman, put some pillow, towel, extra sheets right in here. And that's gonna work. Great. This is another one. I love to do this one. Just get this camera. This is called tuning fork, the small one, the big tuning fork, the small one. So I come up here, get that shoulder, and usually when I'm standing on that right side, so this is right side, yes, I'm using my right hand. So hands is closer to the table. I come up here, get that elbow under my elbow, so it's crossing, and I grab this. Hold on, yeah, I have to stay this way because, yeah, the camera. So, Camera up here. You see, I grab his elbow, on my elbow, and I grab his hands, just like that. So I'm control that. Now this arm is coming up here. Like I said, it's just for the camera. You're not going to be probably going to see on this one. And you start doing this manipulation. You see what I'm doing? I'm moving this around. And I have to stay exactly where the camera is and lock you in, so you guys not gonna see it. But in our classes, you can train and you can practice, but this is how it looks like, and I can move.
It lowers the humerus off out of the joint, so it's room.
He's on the left side. His left side is up. I use my left arm. Like I said, it's just the side he's inclined up, the same arm you use on yourself. And you see it's right there, pop.
Yeah.
And this is our first session. This is our first session. Just think about it. It's our first session. Next session is going to be neck. It's going to be face down. We're going to work on that supraspinatus, infraspinatus, work on that thoracic mobility, work on that thoracic spine, and see how this person will feel. Okay.
And then pelvic lower back.
Yeah, this is going to be next time. He wants to work on his lower back. Yeah, you see people just want some more and more. It's like a drug. So, we're done for today. We're going to ask to get dressed and see
how he's doing,
how he feels. We did good or not? So let me just recharge this camera. Let me wash my hands. All right.
Nice techniques.
Okay, the client says it's been nice. He feel good. Let's see what's the benefits of.
Look at him. He can look. Look at him. Stand. You could stand.
Yeah, he can stand up.
Look how good. See.
Let's get the camera. So just think about it. We just go ahead and see how you feel. Move around.
You can.
Perfect.
No pain.
No pain.
No pain. Can you believe this? In 1 hour, we already changed. So it wasn't like super bad postural, super like something happened. It was something muscular which is holding him, and we release it. But we're definitely gonna work on that. Continue.
Can I go to you?
Yeah. Here we go. So David, you want to come back and say something?
2 weeks I haven't been in the gym because of that. Honestly.
So in soft tissue therapy, there's also rehab to do with bands, and there's a few things that he can do. But you have to, when someone has a shoulder, the shoulder is the most muscular joint. So that means you got to look at the posture and get the posture analysis. If you don't have that, then you don't have much to build on. Then you can do the pecs, and there's an upper pec, middle pec, lower pec. He's got his levator scapula. He's got his 4 rotator cuff muscles. He's got his front delt, side delt, rear delt. He's got 2 biceps, 3 triceps. He's got his serratus anterior. And so rhomboids in the back, trapezius. And there's fascia, a little bit of the fascia that's in there. So you need to have somebody do that. And that's what we do here at LifeRx. We go in there and we do analysis, figure it out, and then do all the therapy.
Yeah.
It's funny because I feel this shoulder is more back than this one. Now.
It's better than this one.
Yeah, because I feel this one is forward, and this one is going back.
Because
more loose on this one.
Of course, kinetic line it's everything. And if you're a massage therapist, sign up on our Patreon. When we show this technique, we work on this technique. And if you want to learn this online, you can also subscribe with us, and like I said, for $17, you can learn all this technique and practice with us. And of course, check our big classes in Los Angeles area. We do 9-12 people class, just more focusing on this technique and teach you how to approach that. And guess what? When you start helping more clients in your life, the more attractive you're going to be to your customers, because you truly mean something to them and you can make changes and decrease that pain. This is what's important right now. those Swedish massages is still good, but they gonna go away. I mean, they slowly go away, and this technique, this physio massage, has become more and more interesting to people. So, thank you very much. Keep your shoulder healthy, and we'll see you next week. And of course, we do Ilbron a little bit homework with the bands.
Exactly.
We're not gonna show it to you because we don't want you to. We want you to do with a specialist. Okay? You guys have a good day. Bye bye.